Hey guys, Sarah coming at you tonight. Tonight's video is going to be about Miss Athena here. So Athena is one of our Anatolian Shepherd dog females. She is 4.5, and so she is not feeling good at all. She started not feeling good probably almost a week ago. So the backstory on Athena is when she was about a year old, she was diagnosed with anaplasmosis. Anaplasmosis is just, you can think of it like Lyme's disease, although I've heard people say that it's much more severe than Lyme's. But it's a tick-borne illness like Lyme's is. And that's one thing that we're really sticklers about, is making sure that you stay on top of flea and tick medications, especially with livestock guardian dogs, because they're outside all the time. They're out in the grass and whatever. This area, we're in Michigan, there's a lot of ticks around here, so we're always really sticklers about it. We've tried a few different kinds of treatments. We do topical now, and the reason that I like to do the topical is because you have so much control over it. Now it's a monthly treatment, which can be inconvenient to remember and have to do it. But, you know, like they make the Bravecto, for instance, which lasts for 3 months, which is awesome. But my issue with that is if you give a dog something internally and let's say they have a reaction to it, it's in their body. You can't, you know, it just makes me twitchy. At least with a topical, if they had a reaction, you could wash it off or whatever. So that's just a me thing. But that particular year, oh, I got a puppy hitting a tripod. Honey, Auntie doesn't want you up here right now, sweetie. She doesn't feel good, honey. I know. That year we tried the Seresto, which is the collar that they use. So we've never used it again because of this incident with her. Now, could it have been just a coincidence? Sure. But I've since found out that there's a lot of knockoffs out there that look like the real deal. I believe, here, go fetch. I believe the company is Bear, like the aspirin, I think, are the OGs that make the Seresto collar. So if you want to go that route, just make sure that you get the real, not that's been sent from overseas. That's all I'll say. Those aren't the real deal. I don't know how much of puppies you can hear in the background. One puppy, one big house dog. Anyway, okay. So I don't really know. Did I get the real Seresto and it just didn't work for her? Did it work fine and she just happened to get it? I don't know. We also vaccinated against Lyme's that year and she ended up getting it. So I don't know. I know that we no longer vaccinate for Lyme's and we no longer use Seresto. So that's just my opinion. Talk to your vet, see what's right for you. Okay, that's the backstory of it all. Okay, so since being positive for anaplasmosis, she now frequently has flare-ups. Changes of the season will set her off. And pretty much every time she comes into heat, she'll have a flare-up. The first couple times after her initial diagnosis, I didn't catch it. I was still learning, so I wouldn't see the prodromal a few days before it really kicked up. I didn't pick up the subtle cues and signs of her going into a flare-up. Now I know, I can tell right away. I'm like, okay, and that's just from knowing your dog. I can't tell you exactly what it is. I can just tell by looking at her, something in her eyes. She kind of looks at me like I'm starting to go down. I don't know. And she's at that gate like that, and once in the house, she knows, like, I feel like garbage. So another reason why right here that I advocate for starting your dogs in the house, get them comfortable coming in your home. Because I wouldn't want her, I sure as heck wouldn't want her out working like this. There's no way she can't work. And even out in the stall, it's December right now, we're in Michigan, it can be nasty. I like to have eyes on her all the time. A flare-up for her is fever, pain, anorexia, which means she doesn't want to eat or drink. That is a normal flare-up for her. So buffered aspirin works really well for her. There's prescription things for pain and fever that you can also get. But we just kind of treat her, we treat the symptoms that she's suffering from. And we were told that each time she gets sick, each time she has a flare-up, it's going to be harder and harder to get her back from it. Hey, you two, I'm trying to do a talkie here. It's going to be harder to bring her back. And one of these times we may not be able to get her back. Pull her through a flare-up. This is by far the worst that she's had. And I'm not confident that there isn't something else going on here. Yesterday I thought we were gonna lose her. I didn't think she'd make it through the night. Right now my husband's, he was in the ICU last night. At least he's out of ICU. He's on a normal floor in the hospital, but he's hospitalized right now. Life right now has not been kind to us. But we're doing the best we can, right? That's all you can ever do. So what I thought was a flare-up, I'm thinking may not be something else, or it might be something else. Maybe it started as that, maybe it's something else, but I think tonight she went over and she drank for the first time in a bit. But I'm still thinking that tomorrow we need to get her in to the vet because I just talk too much. She's having facial edema, which is just fancy for facial swelling, the right side of her jaw and into her neck. So the first thing I'm thinking is like an abscessed tooth or something. So another reason to get your dogs used to being handled and touched everywhere. I went in her mouth, looked down there with a flashlight. Teeth look great. I don't see anything that I can visibly see. But she also has a very quickly growing mass. That is exactly where her thyroid is. Thyroid cancer is a possibility. It could be a lymph node issue. You know, we have chains. Dogs do too, have lymph nodes everywhere, but that is one area. So I'm not really sure. So that's what we're dealing with. That is what is new in our world. Is our Miss Athena here, our OG mama, who's made some of the best pups that we've ever had. She's the mama of that group. So she doesn't have a fever anymore. She's not in pain anymore like she was. But you can tell she doesn't feel well. And these kind of dogs are dogs that are used to being outside, working. So all animals like to try to be brave and put a brave face on, but especially when you have a working dog like this, it's instinctive for them to know that if I'm out working and I'm like laying around and not feeling good, that opens me wide up for attack, and I'm not protecting I'm not doing my job. So by the time they show that they don't feel good, they're really down and out. So I just fired up the rice cooker. I am going to make her some rice. And you can, instead of just making it with water, you can boil it up in bone broth, chicken broth, beef broth, anything to get not, if they're not eating, that'll tempt them sometimes to want to eat. Additional nutrients, try to get it in anyway, as much hydration as you can. You can always do sub-Q fluids if that's something you feel comfortable doing at home. If you don't want to go to a vet, or if you're not able to go to a vet, I judge nobody here, okay? We're all in different paths of life. Going to a vet is not always an option. Maybe you don't have one around. Maybe you can't afford to go to one right now. That's, guess what, guys? It's life. So, it is what it is. So tomorrow I'll see if our vet can even get her in. Our vet, like all the rest in the country right now, are overworked, underpaid, and stretched real thin. So rice is something for her that's easy on her belly. Hopefully she'll eat it. It's soft. It'll be easy for her to chew and swallow with all of that edema and swelling in her face and her mouth and her throat. I'll probably scramble up some eggs, or even raw eggs. She usually likes just fine. Anything that you can get that'll go in and stay down. And of course, if you can get something that's really nutrient dense, great. And we'll see what the vets say. If it is a cancerous mass or any type of mass on that thyroid, she'll be euthanized. We will not do surgery, radiation, chemotherapy. Judge if you want. That's my personal opinion. My personal opinion on that. My job as her owner is to give her the best life that I can, that is pain-free and happy for her. And where she's happy is outside, working, running and patrolling the fields. She can't do that on chemo. She can't do that if she's sick all the time. And I know her, and I know she'd be miserable. So that's why I stand where I stand on that. And it is not a decision that is taken lightly. And it's not a decision that was come to without a lot of tears and prayers. So that's where we're at with her. And of course we will take you along on the journey of getting her to the vet and see what they say, and go from there. So she's only 4.5. She's a young girl yet. Obviously she's not spayed. She's in heat right now, which is one thing that sets off a flare-up. So if this is just a really nasty anaplasmosis, and for some reason a lymph, like maybe a blocked lymph node, I don't know if that's possible, if that can happen. If that's the case, and we can get her through this just fine, I'm going to ask if having her spayed would reduce the flare-ups. If you know, that hormonal shift isn't there to kind of set the body off, then that would be something that we would do too, because she won't be bred anymore. Not only is it's kind of viewed as like an autoimmune thing, and we just believe in breeding the best of the best. Not saying that that's a genetic thing. None of her offspring have had anything like this happen, but to be safe, and because her hormonal fluctuations turn her into this, I can't imagine what a pregnancy would do to her. So just no bueno there. So that is what we're doing. At my feet, I have a large house dog and a puppy that are fighting over a stuffed duck. So it's just always an adventure here. So thank you guys very much for watching. I have to learn to do this housekeeping bit at the beginning of the videos, but if you would subscribe to our channel, that really helps a lot and helps us to continue to do what we do here and try to educate and spread the word on livestock, guardian dogs, homesteading, all that jazz. If you subscribe, if you click that little bell on the YouTube area and hit all, that will then notify you every time we put something new out. I'll also in the description link our Linktree information. From there you can find all kinds of stuff. There's a tip jar there. I don't care if it's $1 or $5 or whatever you want. It helps me to continue to make these videos and bring them to you guys. What else? Our Amazon wish list is on there to help. Stuff we need with my husband and his cancer. I've got a Patreon now. If you want to subscribe to that monthly, I put a lot of information and extra videos that you don't see on here that you can watch and hopefully learn from. I try to interact with people a lot on that as well too. So thank you so much, guys. I really appreciate just checking out our life and walking through it with us. And I'll update you on what's going on with our girl here, and talk to you soon, guys. Thank you.